Greetings. I'm Colonel Karyappa. I'm a public health specialist and a technical advisor in health. I've served for 26 years with the Indian Armed Forces and I'm now continuing my passion in pursuing health for the people through population approach. I will be explaining briefly to you the five key messages pertaining to COVID-19 in the Inform, Motivate and Guide framework over the course of the next few minutes. As you know, you are the person. You are the person on ground who will be required to convey these five key messages to people everywhere. A recap: 1, 2, 3, 4, 5. Simple five key messages distilled by experts from the current state of knowledge for prevention of the transmission of COVID-19. You must know background information. What is the coronavirus disease? That is COVID-19. The infection is spreading from persons who are infected to other persons who are in close contact with the infected persons. The name of the disease is COVID-19. It's caused by a virus, coronavirus. You must know, how does this disease spread? Essentially, it is when someone who has COVID-19 coughs or exhales, they release droplets of infected fluid. Most of these droplets fall on nearby surfaces and objects, such as door handles and furniture or the floor. People can get infected by touching contaminated surfaces or objects and then touching their eyes, nose, or mouth. People can get infected by standing close to a patient of COVID-19 and then breathing in droplets that are coughed out or exhaled by them. Thus, coronavirus leading to COVID-19 spreads in a similar way to the common cold. In my earlier talk to you, I had presented the Inform, Motivate and Guide framework. It's very simply about first informing an individual about what are the key messages. The next would be to motivate the individual to adopt the key behaviors being conveyed through the five key messages. The more personal the communications, the more effective. Keep the individual at the center always. And then, after having informed and motivated, then you guide the individual into action. This stage would require you to demonstrate whatever is required to be done and asking the individual to repeat and demonstrate to you what he has learned. You must have this format ready with you as a reference format. You could think of it as your own personal cheat sheet. Please keep in mind that this format is not for the receiver of information. It's only for your reference. To keep in mind that you will be providing standardized information. All individuals who are conveying messages must keep this format with them. No, this is not for the receiver. The first message would be where you would be informing the individual of washing his hands or her hands frequently. All the conditions where a person would need to wash their hands. Essentially, you need to avoid touching eyes, nose, and mouth with unclean hands. The inform section, the second message: follow respiratory etiquette. That is, covering the mouth and nose with the back of your hand. Try it out right now. Cover your mouth and nose with the back of your hand and not with the front as you would usually do. Wash your hands immediately afterwards with soap and water. Do not spit indiscriminately. Turn your head away from others when coughing or sneezing. Simple sub messages for the main message. The third message you would need to inform: practice social distancing. These are the sub messages that are a part of this third message. The fourth message: Believe only in correct sources of information. Do not believe everything you read on WhatsApp or Facebook. Check the Government of India, Ministry of Health website. If you can't, ask someone who can. Only rely on authentic information. Or you could also ask your government medical officer or the ANM Didi for clarification or information. The fifth message is early recognition and referral for fevers. Not everyone will have a thermometer at home, so you need to recognize high fever early. If you have a thermometer, the temperature, if it's more than 100 degrees or 37.8 degrees Celsius, would classify as high fever. If you have fever, do not rush straight away. First, drink lots of water at home. Use a thermometer or ask your frontline health worker for identifying fever. Prefer to seek treatment from your local health worker or the nearest government medical facility. Do not do self medication and do not seek care from unlicensed people who pretend to be doctors. Do not delay seeking medical care in case of high fever. Very simple sub messages for message number 5. You can take time to go through them again. Coming to the motivation section, we have to understand why is it relevant to the individual. Please read carefully. This is all about the individual. He has to be motivated to understand that this is something that is relevant for him. Do remember, you are not reading this out to him, you are explaining it to him. It's a standard motivation section relevant for almost all the messages that are there. Why is it relevant to the family? Just as for the individual, if anyone is infected in the family, the whole family is at risk for getting infected. They might have to spend a lot of money to recover their health. Can they afford it? Motivate them that they need to change their behaviors, they need to listen, adopt, change, advocate if they want to conserve their health. Why is it relevant to the community? Currently, there is no vaccine or medicine available for prevention of the disease. Hence, following 5 key messages is the only way to prevent spread. It must be told and conveyed clearly to the community too that there is no need for discrimination or stigmatization. It is just an ordinary communicable disease. When I say ordinary, means it is just ordinary for human beings to fall sick through illnesses. Recovery takes the support of a family and the community. Coming to the guiding to section. As we discussed earlier, you need to guide the individual to action. What can be done by an individual and how is it to be done? This is the section where we focus on this. The individual has to practice the behaviors as per the 5 key messages. I'm repeating them here for you. Wash hands frequently, follow respiratory etiquettes, practice social distancing, believe only correct information sources, recognize fevers early, and seek medical care through the ASHA or ANM if unwell. And do remember, these 5 key messages are themes. The sub messages are the ones that you have to convey in the way you would like to convey. Whatever way works in your region is the way that would be conveyed. These are the broad 5 themes. What can be done by a family? Obviously, all actions as for an individual. The next would be as a family, they should not believe rumors being spread around on social media. They should contact the ASHA or the nearest healthcare providers for relevant information. And most importantly, they must keep their house and surroundings clean daily. Hygiene and sanitation are the most important initial measures that a family can put in place to prevent diseases. As a community, what can be done? They can reinforce locally all the actions that are required for individuals. They should not stigmatize or discriminate against sick people. They should ensure cleanliness of surroundings. Do not permit gatherings of people or community events in this season. Do not rely on information from social media. They should facilitate the health workers in doing their assigned work to keep the community healthy. And information can be provided about the national helpline for any information about COVID. Each one to teach many. The bottom line is keep it simple. The simpler you convey the five key messages, the more relevant it would be for the individual, his family, and the community.